Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I am your host, Rainier Scher. Joining me today is Jared Rhoads, the founder and lead instructor at the Center for Modern Health, which is dedicated to transforming American healthcare through the principles of individual rights, rational thinking, and free markets. Welcome to the show.
Thanks for having me on.
I'm very much looking forward to sharing to our audience the work that you're doing, the Center for Modern Health. It's exciting work that you're doing. But before we share that, I also wanted to share with our audience your own story of how you got into this line of work. So how did you end up pursuing a career in health policy?
Sure. I'd always been really interested in healthcare as maybe a top 3 issue in my life that I would, read the news about and follow and care about the little sub issues that come up. But it actually wasn't the first job that I went into out of college. The first thing I went into was actually a financial services job. So coming out of college, I went to work at Fidelity Investments. I was Boston oriented. I grew up and went to school in Massachusetts. And so that's a big investment firm there in Boston. I was interested in that because I followed stocks and options and bonds and everything and trading and stuff as a younger person. And I thought maybe that would be kind of interesting to work in that industry. I enjoyed it in many respects, but kept kind of coming back to a few differences with what I was seeing in that industry and also sort of what I was still, maintaining a pulse on in like healthcare. And one of them is that there's a pretty big noticeable difference between like the world of finance and financial technology and all of that and healthcare that I was noticing. Working in finance in those years, it seemed like things were really well run and like everything was kind of up and running and it was a well-oiled machine and everything was kind of going smoothly. And mainly the job was to like be there and competently manage it and that sort of thing, but not exactly that anything needed like major overhauls or improvements or anything like that. Of course, there would be new products and new services and new things that come up incrementally, but that was sort of how I perceived that industry, like a kind of a mature, well-run industry. And meanwhile, I'm hearing and reading about all these things that are happening in healthcare where, at the time, we're talking like early and mid 2000s, hospitals wrestling with just the ability to share information between health record systems, or even just going electronic on health record systems in the first place. Meanwhile, in the banking and finance world, you can show up at any ATM in the world and, make a withdrawal and everything gets reconciled down to the penny perfectly accurately every time. And there was just a big night and day between like those two worlds. And I actually got more attracted over to the healthcare world thinking, oh, well, they need help there's opportunity there is part of the feeling. And so that's kind of, how I made the early transition into like the healthcare industry. And I've been, in it and following it and working in it for many years ever since.
And in what capacity were you initially involved in the health policy world?
Yeah. So that first job that I took in healthcare going into it, it was in consulting. I never had an interest in going into the clinical side of things, never wanted to go to med school, even though I was, following the issues and stuff and cared about it as an issue. But I wanted to, I like the sort of richness of all of the things that come together in healthcare, ranging from you've got business, right? These organizations need to make a profit and they need to provide services on one hand. And then you've also got the whole politics of healthcare. That's an entire other area that overlaps with that. And then you've got the science and all of that of medicine layered in there as well. Plus like big ethical questions, right? I mean, on the activist side, you've got people clamoring for ideas, asking big questions like, is healthcare a right and that sort of thing. Spoiler alert, I don't think it is. A question maybe for later. It's a very interdisciplinary world to be in, right? There's, like I said, technology and business and politics and economics is a big part of, what's going on and what's working and what isn't and all this. And so there's so many different lenses through which you can look at it. It's like a really rich area to get into. And anyway, so I joined up with a consulting group that was specifically a healthcare focused group. There aren't a lot of those actually. When you think of consulting, usually you think of like the big kind of consulting groups where they're in lots of different industries, right? And they might have, manufacturing clients and they've got clients in defense and they've got some, healthcare clients and then they've got other clients in totally different areas. At that point, I realized that I wanted to specialize. So I made that choice to go into a healthcare specific consulting role, connected with a company that was later bought, but at the time that I joined it, it was called First Consulting Group, and it was there in the Boston area.
And so, did you want to go into consulting on health policy as an excuse to learn about health policy? Like you wanted to scratch that kind of intellectual itch, or was there something specific about providing consulting services for businesses facing these kinds of health policy questions that attracted you to that kind of work?
Good question. It was a little bit of both. So I wanted to learn about the industry first and foremost. And yeah, there are some health policy issues that as a newbie, you can get the lay of the land on and you can weigh in on. But there are other things where it's really helpful to know more firsthand what's going on and to sort of build up that experience. So at least part of that decision and everything was to get into the industry and work in it. And just it's going to be a good way of learning. At the time, I'm sort of young and single, and you can do your policy work on the side and weekends and nights and stuff. And then during the day, if your job lines up with it, then you're really immersed in it, and that's great. And so that was kind of what I was living for a number of years. I did really enjoy being in the consulting side of it, even when I mean, a lot of the projects did have a policy angle to them, but some of them didn't, and even those were really cool to be working with the hospital to figure out is it strategic right now to launch a telehealth program or offering in this particular should we do dermatology right now, or should we go into this other area right now. Working on projects like that are ways of kind of getting to meet a lot of people, getting a lot of perspective on what it's like close up. So I really enjoyed working on those kinds of projects, and also the consulting model where you get thrown into a project for maybe it's 4 or 6 months or 8 months or something like that, and then you've got to get up to speed real quickly and become pretty adept and knowledgeable in it as much as you can, and then you might switch gears and do something completely different. Your next assignment might be different project, new topic, new client, that kind of thing, and so you get you get a lot of good experience that way. Like I said, it did enjoy, kind of providing that value for the clients. These are often hospitals, but we would work with other, health systems and maybe large physician groups as well from time to time, and the technology folks as well, and technology vendors, and helping them all see, kind of where healthcare going in the next, 12 to 18 months. Our group was called Emerging Practices, and so we were specifically trying to kind of stay ahead of the curve. And often that meant learning about the policies that were coming down the pipe so that we could prepare people to respond in whatever way would be most strategic for them.
Right. And so you're providing this consulting service to various businesses. How do you think that gives you a unique perspective on health policy as a topic? Because very often the way that health policy comes across to me is a bunch of experts, either in academia or in government. Health policy comes across as here are plans for reshaping the system in this way or that way. But you're dealing with people with actual needs who are dealing with these policies or potential policies in the future. What perspective did that experience give you? Tell us a little bit more about your more kind of wider perspective on health policy.
Yeah. Yeah. So yeah, working with the people who are actually going to be affected by these policies, right? That is really helpful to see what they react to and what actually really does make their life either better or worse, what makes their job more doable or less doable. You get an appreciation for unintended consequences. I think if I was creating a list of high level concepts in health policy that are worth teaching, unintended consequences is one. I mean, that's just a generic policy concept that's really important. There's always things that you kind of can't quite predict. There's also the cynical view, or maybe not so cynical sometimes, but the view that some of those consequences are actually intended. But anyway, let's just say for the moment that sometimes things don't get implemented in quite the same way. Or some lawmaker wants to propose something and they don't realize how easily it might be gamed or used in the wrong way, or that somebody's going to change the way they do something to get around the policy. And then that's going to lead to a worse outcome. Sometimes this comes up with things like you set like a particular quality metric. It sounds really great. Maybe some of them are good, but other times it ends up causing a reaction in the system because you didn't really think about, well, what's that nurse going to do in that particular scenario, or what's this doctor going to do in this particular scenario, because you're not kind of down in there with them enough. And so I think those sorts of years gave me a bit of an appreciation for that, and to always be on the lookout for things the way that might not work the way you hope that they would. Like a readmission policy, or setting some quality metric that, and then attaching a penalty or an incentive to it. A lot of times those don't work out exactly how you think they might. And I think academics and policymakers who might want to be kind of playing that kind of technocratic role where they're really fine tuning all the dials and everything. If they don't appreciate that point enough, they might have a kind of false sense of confidence in their ability to get things exactly right. Whereas, if you've been there or at least seen it sort of secondhand. I mean, I can't claim to be like exactly like the nurse or exactly like the doctor, but I'm working with them closely enough that I sort of appreciate what they're going through. You become skeptical of some of those, and then you become maybe more trusting in sort of more principled kind of views. Like, and if you understand that incentives are likely to work in a certain way and all that, there's a certain amount of like emergent order that's probably going to come about if you set up a system one way versus another. So anyway, a lot of that has kind of, helped to reinforce my kind of market-oriented view, a lot of healthcare, and that being the best approach forward for a lot of health policy questions.
Yeah, tell me a bit more about that. Has this experience given you insight on what various stakeholders, businesses, organizations need in the healthcare space? Even though in your consulting capacity, you might not always be able to act on it. What kind of insights did you gain, and how did your framework of a free market approach help build that over time?
I mean, a lot of the organizations, they're trying to do the right thing. They're trying to do the best thing that they can in terms of care, and also, there's the idea of no margin, no mission. So even if you're working with a nonprofit, they've got to do things in somewhat of an efficient manner if they're going to keep their doors open, right? And so, kind of seeing a lot of that. There, a lot of times what they were looking for from us, from the consultants, is kind of guidance where there was a lot of confusion and uncertainty. This gets into the policy part of it. Right around this time, a big thing that happened was the EHR incentive component of the Patient Protection and Affordable Care Act. So that's ACA, that's Obamacare, and it had $34 billion attached to it that was linked, was going to be given out for incentives to various hospitals and healthcare facilities as an incentive for them to adopt electronic health records, right? Well, in the law, they just sort of sketch it out at a relatively high level, but they leave all sorts of details up to the administrative component of the executive part of the government. And so now you've got HHS who gets handed this document. There's hundreds of places in there. People at the time were counting the number of places that it says in the law, the secretary shall propose a rule that does X, Y, and Z. And so they've got to now go through a rulemaking process of all that. And so now that means more time. It also means that there's a lot of uncertainty on how things are actually going to fall into place. And so if you're a hospital maybe and you're saying, well, okay, well I want to be on board here. It probably is time for us to adopt EHRs, electronic health records. What system should I go with so that I know that I'm going to be, doing what I need to do, right, in order to, communicate with other hospitals, et cetera. In the case of the incentive, a lot of times they were wondering, well, what do I have to do to make sure that I qualify for the incentive and avoid a penalty, right? Because there are also penalties built into that over a certain number of years if you don't do things. And so they were asking from the consultants to, can you boil down this, 1,000-page document and pay attention and follow all of the subsequent Tiger Team meetings and all the, the conference calls and everything that and all the notices of proposed rulemaking that were coming out. And so our job would be to understand all that and then kind of translate that from, well, here's the policy that's being made and it seems like it's going in this direction. That's what our educated guess is here. And if that's the case, then you might want to be looking at this kind of path forward. And those get all built into a set of recommendations and tools and calculators that we would build to help those organizations basically find their way forward and kind of an activist government, I guess, a government that's kind of probably more involved in that than they ought to be.
So, healthcare, to put it lightly, is very much a maze. You can use other metaphors to describe it, a jungle. It's very complicated for people who are trying to pursue certain values in this space. It's very difficult. And so, for a very long time, you have been acting as a sort of a guide for a lot of these businesses. So eventually, you go from this kind of role as a guide in your consulting capacity to the more kind of academic level kind of health policy work. So tell me a bit about what motivated that change for you.
Yeah, sure. Yeah, so I was in consulting for like 9 or 10 years. It was close to 10 years. But then, one of the things that I remember thinking is that this is nice. I like that I like that I know I'm helping somebody, on each of these projects, and that's nice. But there's kind of a scaling problem with that. At least, I mean, you can go through and have a perfectly happy and very fulfilling career in doing that. That's fine. But as you see sort of high leverage opportunities where you're thinking to yourself, oh, and if we could just make this one policy change, that would fix a lot of things. As it would fix things for 1,000 hospitals at once, as opposed to, just kind of going and helping one hospital at a time with whatever challenge that they have. And that they're facing. And so anyway, I kind of was thinking of health policy. It became obvious that was almost like a higher leverage kind of way of bringing around change and improving the U.S. healthcare system. So that kind of motivated part of my veering back into health policy more, and I did that through academia. I went back to get my MPH. Um, and I did that. I was getting involved in research at that time as well. And then that's when eventually that led to getting into academia as teaching, which I really enjoy too. And I've been doing that for the past 7 or 8 years. So I teach up here at, I'm in New Hampshire, and I teach at Dartmouth in the Master of Public Health program that they have. And I teach a couple of health policy programs. I also teach a health policy debate course. And then I also do mentoring and practicum advising. So I'm like a research advisor for a handful of students each year as well. So between those several courses and the research advising, that's something I've really enjoyed these past 7 or 8 years as well. And that's been really great. That's on a personal level, it got me kind of into the classroom and at first again as a student, but then again as a teacher, I discovered that I enjoyed that. And teaching both from experience, but also from the published literature and the kind of conceptual things that you would want to cover in those kinds of health policy courses. I just sort of enjoyed all of that, as well as the interaction with all the students and the constant newness of it all was really something that I liked.
And what was it like teaching health policy when I assume very often you might be the only kind of free market person in the room, or maybe only the second? What was that like?
Yeah, no, you're right. That's fair to say. I can probably count on one or two hands the number of students that I've had over the past years that are kind of like obviously, market oriented in any kind of way. Um, I love my students, I love my colleagues. They're great, but they do, and this is actually more of a what I'm about to say is more of a commentary, I think, about the field actually than anything like in particular about our particular program or Dartmouth or anything. Which is that I think the field is just sort of philosophically inclined right now to attract a kind of maybe if you were to put a political label on it, it's something left of center, but it's even more to say about that, which is just the sort of orientation that look the way to help people is to like get them onto a program or to seemingly the solution to everything is to, well, if you expand Medicaid to include this service, somebody lacks X, let's come up with a program to provide it, and that's sort of it's just sort of the default go-to. And I'm not sure how much of that is like a really thought out and planned kind of thing in this field, and how much of it is something that I don't know is arrived at in a different way. Unfortunately, I think there's very little focus on kind of market oriented ideas, which I think is something that public health programs and health policy programs should be looking more at, but they kind of don't. I'm fairly confident that not too many MPH programs, if you could look at every single syllabus out there, you're probably not going to see too many times where, Milton Friedman's article on occupational licensure was assigned as a reading, or to pick something very more recent, like, John Goodman's really good book called Priceless, which is about kind of the importance of like a price mechanism and that kind of thing. And I could go down the list. There's like good stuff out there on the market oriented side that just never gets even assigned or even brought up. It's as if it doesn't exist. And so that's kind of maybe the one frustration of being in an academic setting where almost everybody's on a different premise.
Right. So it comes across to me then that the kind of intellectual space that you would operate in if you're in health policy as an academic field is one where, in many ways, the kind of fundamental debates have already been settled on, well, should healthcare be a right? Should the government be heavily involved? In many ways, it then seems that those questions have been settled, and it's more a question of, okay, how much should government be involved? What would it look like for
Yeah.
healthcare to be a right? How do we implement this and that program? And all the kind of
Yeah.
free market perspectives, which do exist, kind of exist on either on the periphery of the field or aren't even considered as part of the field. Would you say that's correct?
I think that's a very good way of putting it. You're absolutely right about the sort of assumption that these things have already been asked and answered, and that to the extent. And now it's not that there aren't books being written or some white papers or articles being written on kind of market oriented ideas out there, but they're going to be coming from like kind of think tanks, and there'll be white papers more so than academic papers. Maybe you can find Um, some sort of market oriented papers that come out of the economics disciplines. An economist gets interested in some healthcare issue, dips into healthcare just long enough to write a couple of papers, but it's really just kind of a side pursuit for that person. They make into the literature a little bit, but not really. Yeah, it's kind of frustrating that there's the feeling that that these questions have been answered like that, and that we can't kind of revisit those and maybe find some different answers to those.
Right. But you just mentioned something which I think is worth exploring a little bit further. It also sounds like there isn't a kind of sustained community of people working on health policy from a free market perspective. You do have individuals, you do have think tanks, you'll have the odd economists who writes something about healthcare and then leaves. But unlike the perspective that healthcare is a right and the government should be involved, which has like a whole army of people behind it and kind of taking that for granted, there's no equivalent of that on the free market side.
So the other side gets the advantage of having basically the whole university kind of culture being sort of pushing their way. And then on more of the market side, there isn't even a really a way to major in health policy. I mean, there really aren't too many places that like offer an undergraduate, BS or BA in health policy. It's almost because you have to go through like a public health king or a global health program or something like that. One of these kind of different different fields that are, sort of adjacent to it. It's actually kind of, I've wondered why though, because when you think about it, it's this health policy is this thing that influences almost $1 in $5 that are spent, GDP wise. It's like 17, 18% of GDP is spent on healthcare, medicine, and there's this field of health policy that, seeks to understand how all that works and everything. It affects everyone. And it's not some little niche, but yet it doesn't exist in universities in the same way. So when I say that I teach the health policy courses that I do at Dartmouth, that's in an MPH program. I'm not sure if I mentioned that or not. So it's a Master of Public Health program. It's good that the people that are in that kind of program, I like one thing I like about it is that it's people who are like primarily there an interest in health care, in total, as opposed to, let's say, if I was in teaching in an MPA program, so that's Master of Public Administration, or an MPP program, Master of Public Policy, something like that, where it's, they might have a course they might even have a whole concentration in healthcare, but it sort of exists within a broader framework of like policy or something that. I actually kind of like that, being in an MPH program, like everybody is there looking at health all the time and in, different parts of health, different components of it. But it's sort of one more channel that I think would be good to get more people coming out of that viewpoint, coming out of that kind of set of interests, and then to get some more market oriented viewpoints across to them. That would be good.
So you started out giving consulting advice to businesses, which was valuable to you, but you wanted to scale things. So you realized that, okay, I need to go into health policy proper. Um,
Mhm.
then you're able to teach people, but you feel like you are limited in many ways to how much you can impart on them a more free market perspective. So, how did you go from teaching a health policy in the university context, which you still do, to setting up
Mhm.
Center for Modern Health? What motivated that, and what did that look like?
Yeah, so that is really to be able to teach exactly the kinds of perspectives that I think are under recognized and not brought up enough, like the Friedman articles that I mentioned a while back in the Goodman book and everything, and many more. I'm looking at all the resources out there and thinking those could be an entire curriculum in themselves, and so that combined with this sort of realization that you know, I love teaching the students that I have now and everything. They're great. How much, there's also this thought in the back of my mind, like how much better would this be if all the projects that they were working on were things that I also like really liked and agreed with deeply and philosophically. That would be even better. And so that's kind of what got me thinking that I should start something where it's almost like a maybe part think tank, part educational institution. Still trying to figure out like what's the right way to shape it and what's the right way to kind of position it. Because certainly I do love writing articles. I love doing the odd research project. I love that kind of part of it. So that would be what I would consider like the kind of regular good think tank work. Like we need places doing that. There's so many sub issues that make up health policy, and some of them you could spend years on. Just on those little sub issues, and then there's so much else flying past you if you're just focused on one thing. Like you could spend just several years just on right to try. I mean that was an idea and a concept that took many years for people to get going with it. Christina Sandifer from the Goldwater Institute got that up and running with her colleagues and network and coalition. But that's not something that you just do for half a year or a year or something. You've got to get really into that and move that along over the course of many years. And there's that's just like one of hundreds of components of health policy. We need lots of people like working on these kinds of things. I enjoy the research and article production kind of thing, but I also, because I also know that I enjoy the educational part of it, and because I think we really need we can't just ask for more papers to appear out of nowhere. You need the people, you need to develop the talent and the people that can do those papers and do that research and be the advocates as well. So I think we also have on the market oriented side, we've got kind of a talent production or talent pipeline production problem that we need to solve too. And so that's at least half or more of what I want the Center for Modern Health to do. So I've got a summer fellowship program that I've started up. People are going to come up to college age students who are interested in really jumping in and immersing themselves in health policy studies. Are going to come up to Hanover this summer, and I'm going to work with them on both the teaching part of it, but also getting them to do some work in this area, some actual applied work in this area, and kind of grow both the educational part of it and make that program, scale it so that it can reach more students as well, alongside doing some of my own writing and publishing.
So you've laid out a bit of the problem that we're facing from the free market side. We're up against a whole lot of people who aren't for free markets. Then there's the fact that you have all these issues and sub-issues that any one person could spend like their whole like a decade or even their life on. So it's about building a larger number of people from our perspective. But what is your kind of deeper pedagogical perspective of what's required to do that? Is it just like learning better economics, that people are just ignorant on why free markets would work in healthcare? What's required not only to get us to a higher number of people with a free market perspective, but for them to actually be persuasive? Another way to put this question is, why are we losing?
Well, that's $1 million question there. And I don't know that I've got the special sauce yet. I mean, I kind of I've got at least two answers to that. On one level, it's a big undertaking, it's a big project just in general, getting more market oriented ideas. And so at sort of like a superficial level or for first level is more people working on this is likely to be a good thing. And I welcome from the division of labor standpoint, almost, all comers, right? In some sense, right? So it makes me happy that there are some people in law that delve into health policy law. And it makes me happy to hear that there's some econ folks that, they're trained as economists, but they like to jump into some health policy. So that's nice. But I also kind of at the more deeper level, I do think I'm kind of approaching this from this like integrated philosophical, but also kind of like a fully, I don't know how to describe it, like a kind of a like life-oriented approach to the design of my own program, where I think it's important to understand, for instance, like some of the philosophical and political economy original articles that are big issues and big questions. About like, for instance, what are individual rights, and like how can we properly think about those and present them and like make the case. I wish it was the case that more often we just kind of respond to something by pointing out, well, that's an individual rights violation, and so that's why I'm not. And sometimes that works, but not always. And getting to why it doesn't always work, and then getting to the question of and the answer of like, well, what can you do about that? How do you approach that? There's work to be done there, absolutely. But I do think that bringing in that perspective is really important. The curriculum that I've designed, it's got some, like we start with like Locke, and get to kind of like old rights questions and that kinds of understandings of things, and then bring it all the way through to more recent thinkers. I also I'll even mention this, like I also kind of like to integrate the humanities in this in a real way. Like I've got one draft of the curriculum that I've got has several readings from that are like great literature where important things have been discussed and wrestled with and presented. Henrik Ibsen's An Enemy of the People, for instance, and a lot of other good even some short stories and whole story even that you can get into. Getting the kind of like a kind of a I think of it as like an integrated view of how this all works together, not just not just the econ part. That's important, but there's more to it than that. And I think we need to do some thinking about what messaging and what way of presenting various philosophical issues are going to be the most effective, and how do we bring about change using that? Yeah.
And how would you say that your approach to, let's say, building up the future generation of free market, health policy oriented thinkers, how does that differ, do you think, from other people who are free market oriented in the health policy space?
Yeah. If you look at like some of the other just sort of organizations that are out there that are doing great work in terms of articles that they put out and white papers and that sort of thing, they don't really they don't really have an educational program per se in the same sense that I'm looking to develop, and that I've got that I've got sort of going here with the initial summer fellows program, but then also want to expand and do more. Some of them might have like an internship that you can, one or two people can go and work for, and that's kind of nice, but they're not teaching classes in that. It's more like if you're a young person, college student or something, you're kind of working for them, and you're getting exposed, and I'm sure those are good programs and all, but you're not like taking it's not like being in a classroom setting where you're learning and really getting to wrestle with the ideas the way that you should have if you had done let's say a graduate program, but it hadn't been so slanted. So just the sort of like design of it, and then the approach that I kind of sketched out just before. Those kinds of two things kind of make this. I think there are places, there are think tanks, like I said, that might have an internship program. Maybe they put together like a conference once in a while or something like that. And those are all great things. We need that. We need more of it. But it's kind of we're in health policy, we're so outgunned. We kind of need an all hands on deck approach. And while other places are doing their conferences and maybe internships and stuff like that, well, I can be the part of the solution that offers like an educational kind of gap fix. Like if you went through an MPH program and you felt like you only got half the exposure to half the ideas that you should have, this is a way to fill that, remediate the education experience that you had. So that's kind of what I'm going for.
But surely it's not just a numbers game, right? I mean, so if your program succeeds, and let's say 10 years down the line, we have, I don't know, 10 times more people with a free market perspective in health policy, what is it about your education program that will empower them to actually convince people, other than the fact
Yeah.
that there are more of them?
Yeah, right. Yeah. No, you're right. It's not just a numbers game. I think uh, when the ability to look at something in terms of principles, I think is sort of like a leverage point there, and bringing that perspective to the program and then in the education in this program, that gives people it's like a multiplier effect, because it's not just a tool that you can use once on one particular issue, and then we would need a specialist for every issue. There's I think the leverage there is that thinking about and applying these principles, you can apply them to lots of different issues, and then when the next thing that comes up that operates a little bit more similarly to the one that you just are working on, it's possible that applying the same approach, first of all, if you've done it well the first time, you might not even face the problem. It might be fixed on its own. But it also is it's almost like a toolkit that can be used for lots of different on lots of different issues.
Give me an example of a kind of a principle at stake here.
Well, I mean, being able to look at something from the perspective of individual rights, let's say, and respecting the individual choice on something, that plays into something like right to try, which is the idea that people ought to be able to have the ability to at least ask to be able to take an investigational therapeutic before it's approved by FDA. and that the government can't stand in your way and stop you. But then that, the a sort of similar kind of thing can also be maybe in insurance, right? And that would be new because we haven't really seen a kind of like individual rights oriented approach to asking or challenging some of the premises and assumptions under the way that insurance is currently held in the U.S. And to be able to kind of demand that you be able to be insured for an amount that represents your actual actuarial risk and everything, that would be a completely different, or to be a consumer and to be able to spend your own money the same way that somebody else can with the equalization of the tax treatment there with the relative to whether you buy it through your employer or not. Right now, we treat people very differently whether they purchase insurance through their employer or not. One way you get a tax break and the other way you don't. Well, that's a pretty weird, actually kind of U.S. centric, idiosyncrasy there. And there's probably a way of looking at that and applying, an individual rights kind of framework to that to put together an effective way of advocating for change on that. But that, a lot of the details have to be thought through on that. It's something that nobody's quite done yet. There are different ways that have been tested a little bit around the periphery, like shopper initiatives and that sort of thing, but nobody's really challenged it at its root. And so that's another place where you could kind of use some leverage and from having learned and understood one kind of philosophical idea and then being able to apply it in some other place.
So I think the right to try example is a really good example because it's both an example where you can make it relatively clear to people how not having that right is a violation of your rights, right? You have a rare
Mm-hmm.
condition, you are willing to try an experimental drug in consultation with your own physician, and the government is telling you no, you can't. But you think, what the hell? It's my life. And
Mm-hmm.
all sorts of ways in which that same kind of violation, where the government steps in and says, you can't do this, is happening all over healthcare. And so,
Mm-hmm.
what I really like about what you're trying to do, Jared, with your program is educating people on how that's happening all over the place. Something like the right to try shows that it is possible to convince people. It's just really hard showing other people all the different ways that their rights are being violated.
Yeah. Yeah, you're absolutely right. And one of the other kind of frustrating things about health policy, but is that a lot of times you have to work on from the periphery inward. You and I can look at the system and kind of understand this other area over here is sort of more fundamental, and it's the heart of the issue. Can't we go there first? And maybe you can, or maybe you can direct some general thinking toward that area, but possibly the action area might be somewhere else, and it ends up becoming a whole strategy, right? Because maybe it's the way to go about change is you get a small win over in this peripheral issue, and then you can use that as a like a proof of concept maybe. And so then there's a lot of strategy going into to figure out what the best way is if you actually care about making and achieving some change. But yeah, it's going from issue to issue, you can see these kinds of parallels. There's such an interconnectedness to healthcare that I think we can help to shed some light on. Sometimes it's the same problem just popping up in different ways, and there's also a lot of assumptions that people make about healthcare. A lot of people think we have a free market healthcare system already, and are baffled at when we suggest that otherwise. And there's a lot of work even to be done right there to clarify that the extent to which some possibly well-intended law over here has really messed something up a couple steps over to the
I'd like to end with a little anecdotal note. So when I started getting interested in health policy towards the end of my PhD, I was really having trouble finding different books and articles from a free market perspective on health policy. Right? I could find some here, find some there, but there wasn't like one place where they were all gathered together. And I'm
Mm.
still finding them here and there even today. But then when I heard, Jared, that you were starting up the center, and I went onto your website and I clicked on the curriculum that you had developed up until then, I
Mhm.
was blown. I was like, oh my God, here are all the sources that I need, at least a lot of them. Some of them I already had, but others I didn't. I think that really shows the point that you were just trying to make, is that there isn't really a free market perspective here. If there was, there would be some kind of canon, but it's still such an early area of development. And I think
Yeah.
that's what makes your work so exciting. And yeah, with that, would you like to tell our audience where they can find out more about the educational program that you're working on?
Yeah, and thank you. So the website is centerformodernhealth.org. And I'm also on Twitter, Center Mod Health, or you can also follow me personally, on Twitter, Jared Rhoads, or Twitter. But those are the two easiest places to find me, and in the Center for Modern Health. And we're just putting out articles and putting out also the educational programs and trying to kind of build up a more of a community of people that can benefit from these ideas.
Thanks, Jared. Looking forward to hearing more about all your work.
Thank you.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.